The University of Vermont Medical Center is teaming up with an insurance provider to launch a new program that will help provide affordable treatment for Vermonters living with chronic pain.
Local 44's Devin Bates checked out the facility and also spoke with the medical director behind the program today. He joins us now live in the studio with the big details. Hi, Devin.
Well, Lauren and Glenn, it's called the Partners Aligned and Transformative Healing Program, and given that the overprescribing of pain relief medications was a major factor in what we now know as the opioid crisis, this is the kind of initiative doctors believe could open up new options for those suffering from chronic pain. For many Vermonters suffering from chronic pain, treatment options such as massage therapy, acupuncture, and group support can get expensive, leading many to opt for prescription drugs that doctors say aren't an ideal solution.
We know with medications or with opiates that they have limited success in terms of relieving pain, right? And they also can be risky for folks. And we have not, as a field, had tremendous success in helping people find more comfort or be more functional.
UVM Medical Center's new Partners Aligned and Transformative Healing Program, launched along with Blue Cross Blue Shield of Vermont, is an 8-week program looking to open up that wide variety of treatments to a larger audience by using a bundled payment model that allows access to all of those services for one fixed price.
It's not just the individual coming in one-on-one to a doctor's office and getting a prescription. It's a group of folks looking at somebody's situation saying, yeah, from my standpoint as an acupuncturist or as a Reiki master, I think this might be helpful. And it's a team approach that enlists lots of different forms of wisdom.
Now, if you're anything like me, cooking better is probably pretty high on your list of priorities, and you might not think of cooking better as one of the primary things when it comes to treating chronic pain. But here at UVM Medical Center, as part of this 8-week program, you'd actually get to see a nutritionist to try to help get your diet better as part of an overall wellness initiative.
We are also trying to collaborate more closely and kind of focus on paying for value, paying for outcomes, rather than paying for services. So the idea with a pilot like this is to trial this as a pilot, prove its worth, and then scale it across the state.
Now, the hope is that all of these different treatment options can be used together long-term instead of prescriptions to maintain a higher quality of life. Participants will only have to pay the cost of 2 primary care visits, one for each 4-week segment of the program. Live in studio, Devin Bates, Local 44 News.